Sponsored by Kids Clinic at Punggol and Biostime Probiotics. Now, Biostime is the world's #1 brand of children probiotics. And it gives me great pleasure to actually invite Dr. Dave Ong from Kids Clinic at Punggol to actually join us today. And Dr. Dave Ong has taken time off his very busy schedule to actually come on board and share with us some tips and concerns that young parents or parents with children may have regarding the immunity of their child.
Hi, I'm Dr. Dave. I'm the pediatrician of Kids Clinic at Punggol. So I'm very happy to be here today to share with you some tips regarding how to build your child's immunity.
Now, good afternoon, Dr. Dave, and thank you so much for joining us for this event. Now, as a pediatrician, I'm sure you have encountered countless of young parents with children who are very concerned regarding their well-being. Can you please share with us more?
Alright, so these are some of the common infections that parents might encounter when they bring their child to see the doctor during the childhood period from newborn all the way till like preschool. So you can actually see things like common colds, where where the child has a sore throat, running nose, cough, phlegm, fever, and then of course the famous influenza or flu virus. Also, many kids have bronchitis or bronchiolitis, where they have wheeze in the chest, and stomach flu, hand, foot, mouth, as well as viral fever. So these are some of the common infections that tends to happen and tends to cause a lot of discomfort to both the child as well as the family. And usually when we ask these questions to parents, how often does the child fall sick? Very, very seldom do we get an answer once a year, unless the child is actually quite old, after the preschool period. Most of the time we get like once a month, once every 3 months. Actually, during the pre-COVID period, when all these precautions of social distancing and masks were not there, school-going children can fall sick as frequently as once every 2 weeks. So we actually even see parents telling us as though the child has never really recovered from the illness, because sometimes these might actually be back-to-back viral infections. So what exactly is the immune system? So generally, if you look at the slide, you can see that it's actually like an army that fights away the germs that come into the body, whether it's viruses or bacteria. And it's important to know that there are several organs that are part of the immunity, but 70% of our immunity is actually found within the gut itself. So therefore, what you actually take orally does contribute to the immune system. And I think it makes sense because when we eat, we want the immune system to be able to filter out all the germs that are found in the food that we ingest. And concurrently with this fact, you also know that some of the food that you eat can actually positively reinforce the immunity level from the gut itself. So these are some of our immune cells. So these are the white blood cells called lymphocytes that actually fight viruses. And of course, we have the GRAN team, which are the granulocytes that fight bacteria. And what exactly can actually go wrong with the immunity in children? Most common will be frequent infections because they go to childcare or school. And of course, the other big problem that we face with many kids is allergy and atopy, such as asthma, allergic rhinitis, sensitive skin or eczema, as well as food allergies. And of course, there are less common immunity issues like autoimmune disease, where the immune system actually attacks its own organs. And of course, immunodeficiency, which is a very rare condition where there are certain defects in the immune system, making it unable to fight germs properly. So, coming to the crux, right, how do we actually build your baby or your child's immunity? And I think the first thing that is proven is that there should be exclusive breastfeeding, okay, for the first, at least the first 4 months. And this has been shown time and time again through many research studies. And the main reason behind it is because you will be able to transfer a lot of good antibodies from the mommy to the baby. And however, this must be balanced. There must be a balance achieved, because we don't want to overtly stress the mothers out, such that they are going through a very, very hard time in trying to provide exclusive breastfeeding. And at the same time, we know that stress will also reduce the breast milk supply. So we must take it a bit more gently and encourage our mothers, give them some of the measures that can help them to improve their breast milk supply, but yet do not overtly pressure them to doing it, and we should never ever make them feel bad about it if they're unable to breastfeed exclusively. And then the second point is to complete all the immunizations and the vaccines according to schedule. And this is well known to many people because because our country has a very good vaccination system. So things like the 5-in-1 hepatitis B vaccine, MMR, all these will have to be done, and pneumococcal as well. But however, there are some optional vaccines that I want to highlight which sometimes has been under-emphasized. For example, the influenza vaccine. This is very, very important to protect our kids and our adults from the circulating influenza virus. And the influenza viral illness can be very severe, for example, in the case of H1N1. So I think in the light of the COVID pandemic, we should be trying to get everybody protected from all these vaccine preventable illnesses as much as possible. And of course, the other optional vaccine that is important to me, at least, is chickenpox vaccine, because I think chickenpox being a very infectious condition, and the need for a child to have a MC for 2 weeks, right? You don't want the child to be having chickenpox during a major part of his life, for example, major exams. And therefore, I think it's something that is worth getting. But the other important thing I want to emphasize is that this is an era of anti-vaxxers. There are a lot of people around the world who are very, very worried about vaccines in terms of, for example, false claims that vaccines are causing autism. I think this is something that we must continuously try to fight against, because if not, you will see certain infectious diseases like measles. Measles, the number of cases worldwide is becoming higher and higher, because there are people who are not doing measles vaccines due to fear of the vaccine causing autism. And now, even with the COVID pandemic, when there are lockdowns all over the world and reduced access to healthcare, there are many people who are cancelling and postponing their childhood vaccination. So therefore, we should continue to encourage people to come for the vaccines on time. Sufficient sleep is very important, because it's during sleep where your body goes into rest and repair, and the stress hormones start to come down. Insufficient rest will definitely lead to a lower immunity. And of course, secondly, a balanced diet with lots of fruits and vegetables of various colors. And we talk about bright colors because some of these colors, like bright yellow, orange, red, comprises antioxidants, which are good for the immune system. And of course, exercise, because exercise are known to release chemicals that help to boost the immunity. And if you do it as a family, it's very good for bonding. And the other positive part of exercising, if you do it outdoors, is that you get sun exposure, which helps your body to manufacture vitamin D. So I will speak a bit more about vitamin D after this. And of course, stress management, which can be quite challenging in our very highly competitive environment. But of course, I think for our kids, we need to set aside time for them to relax, and also have a good timetable with good time management, so that they don't accumulate all their work to the last minute and contribute to the stress level. And very importantly, there should be no secondhand smoke exposure, because this is known to predispose the kids to recurrent respiratory infections. And for some cases, it can actually increase the chance of them developing chronic respiratory conditions like asthma. And I think the last point, the importance of continuing to go back to childcare and school as per our local pandemic guidelines. I think this is very important to know, because actually our immunity, as I mentioned, is like an army. And the reason why you see that the older kids at preschool level and primary school level fall sick less than the young infants is because these older kids have actually exposed themselves to various viruses and germs in the early part of their lives when they went to school and during growing up. And therefore, the truth is that as much as we don't want our kids to fall sick, it is actually true going to school, going out in the environment and being exposed to some of these common infections that build the army of antibodies that can help them to fight these germs in the future. And what we are trying to do in helping them to boost their immunity is not about not letting them fall sick, but to be such that their immunity is able to clear the germs relatively fast, so that the illness is not as severe each time they get it. So the other thing, although it's not directly related to boosting immunity, I think we have to emphasize the need for our kids to have reduction of exposure and spread of germs, especially during this COVID pandemic, when we do not want anyone to catch the COVID virus that we know so little of. So importantly is to teach them regular hand washing during the many moments, like after sneezing, coughing, and going to the bathroom, before and after eating, after coming back from school or childcare, using hand sanitizers on the go, and this has to have 70% alcohol in order for it to work. There are also non-alcoholic hand sanitizers, but usually the efficacy is a bit lower. Importantly, we have to get our children to mask up. Now the current guidelines is that below 6 years old, they do not need to wear, it's not compulsory for them to wear a mask, but I will still encourage it for the kids who are above 2 years old. Because I think the wearing of masks have truly helped to reduce the frequency of infections. And as a doctor in the pediatric clinic, I can truly see that the acute infections have dropped a lot since everyone started wearing masks. For those who are below 2 years old, the reason why mask wearing is sort of discouraged, because there is a risk of suffocation in these younger ones, and we do not know when it will happen. So therefore, below 2 years old, it's not compulsory for them to wear masks. For face shield, I actually put a question mark, because face shields do not truly protect you from the droplets, because there are all these gaps at the sides and below, and it is mainly reserved for certain groups of people who are unable to wear masks. For example, these kids who are less than 2 years old, and in our local guidelines, people who have certain medical conditions like respiratory or cardiac issues that may make them not able to breathe well when they wear a mask, or even teachers in school who are at a distance away from their students and they need to speak, they are able to, face shield is one of the alternatives for them. But for the general population, we should still recommend masks for everyone. Then of course, avoid crowded areas. Although we are opening up, I think we should still put in some effort to do a bit of social distancing, because when you start having big gatherings which are not necessary, you may end up having another outbreak again. And of course, stay at home when unwell, because you do not want to spread it to other people. So these are some of the supplements that actually has some evidence in terms of boosting our kids' immunity. So I've actually listed out a broad group here. So vitamin C, which is what everybody knows about, zinc, Baker's yeast beta-glucan, this is something that is not very well known, as well as vitamin D, which I mentioned that I'll be sharing. Okay, and then of course, very importantly, probiotics and prebiotics. So probiotics, some of the names that you may have heard before are bacteria like Lactobacillus, Bifidobacterium. These are the live good bacteria which are actually found in food or in supplements, and they have many health benefits. And then for prebiotics, they are essentially complex carbohydrates that helps to digest that the humans cannot digest, and they are actually serving as food for the probiotics so that the probiotics can grow in your intestines. And some of the common names that you may have heard of includes things like 2FL. So vitamin C, there's quite a bit of high-level research studies that have been done. These are called Cochrane reviews, and they have shown that regular intake of vitamin C actually helps to reduce the duration and severity of colds. So there is good evidence for taking regular vitamin C every day. Zinc is also the other actually less emphasized nutrient compared to vitamin C. It has a lot of positive benefits in reducing the severity and duration of the cold, and can even be has even positive evidence in terms of reducing the incidence of lower respiratory infections like pneumonia. Baker's yeast beta-glucan is actually something that is not as extensively studied as compared to vitamin C and zinc, but I personally find that it works very well. And this is one of those supplements that is studied a lot more in China, and they have even added BYBG in some of the milk formula in China, and they have done some studies which showed that the frequency of respiratory infections actually reduced quite significantly. And at the clinic level, when my patients actually take certain supplements that contains BYBG, they actually see at least a 50% reduction in their infections after taking it for at least 2-3 months. So I think it's something that is worth exploring. So vitamin D is something very important, and I think it needs to be emphasized more. It is actually an immune modulator. Okay, so a lot of people think only know that vitamin D is good for the bones and the growth, but a lot of us are not familiar with the fact that the latest studies in the past 10 years have shown that vitamin D can boost the immune system. Secondly, it can modulate the immune system. So when you say modulate, it means that the immune system will be strong enough to fight the germ, but it will not be excessively strong such that in the process of fighting the germ, it actually attacks your own body and cause the damages. This is what you actually see in COVID patients, where actually patients die because they actually had a hyperactive immunity in trying to clear the COVID virus, and in the process, it actually destroys some of the internal organs. So vitamin D has been shown to be a modulator in that sense and prevents the immunity from attacking your own body organs in the course of fighting germs. And there are also studies in COVID patients that show that those who have sufficient vitamin D levels actually do well compared to those who do not have sufficient vitamin D. And other research studies involving non-COVID patients, when you have insufficient vitamin D, they have been linked to higher susceptibility to infections, and also the infections being more severe than usual. So probiotics and prebiotics, as we mentioned earlier, probiotics are live bacteria that go into your gut and confer a lot of health benefits, including boosting the immunity at the gut level. And this is very important because 70% of our immune system is found in the gut, and when they interact with the probiotics actually help to boost the ability of the immune system to fight germs, and at the same time, just like vitamin D, moderate the immunity so that you can prevent it from becoming overactive in fighting the germs. The prebiotics work hand in hand with the probiotics in the sense that they are food supply for the probiotics. And when you have sufficient prebiotics, all these good germs can thrive and grow in the gut in a good amount. Okay, so these are some of the positive benefits that of probiotics that you can see. So besides boosting the immune system from the gut level, it actually helps to prevent gut infections such as stomach flu. It can help to treat diarrhea. And when the child is on antibiotics, right, it can reduce the incidence of antibiotic-related diarrhea if you take probiotics 2 hours apart from your antibiotics. And even in premature babies, probiotics are shown to reduce certain gut complications. For prebiotics-wise, they themselves promote the growth of the probiotics, and they themselves also have immunomodulatory effects in helping to boost the immunity and prevent the immune system from becoming too hyperactive and causing damage to the body as well. For allergy, just a small mention, there is actually growing evidence, in fact moderate evidence from the Cochrane reviews, that if mothers take probiotics during the 3rd trimester of pregnancy or during breastfeeding, you may actually help to prevent eczema in early life, especially if there's a strong family history of eczema. But however, the caveat is that for those who already have eczema, feeding probiotics to the child or to the mothers while they breastfeed, the evidence is not as clear. So in terms of prevention, it's actually more during the 3rd trimester as well as during breastfeeding in those who have not had eczema yet but has a strong family history of eczema. The probiotics might actually help to prevent eczema. So some of the food which are rich in probiotics includes probiotic supplements. I think this is important to emphasize because even though there are food available, there's a limit to how much your child can take. So by taking the supplements, you have a proper dosage and the proper strains of probiotics to achieve the correct medical effects. Okay, so that's why this is very important. And other foods which are rich in probiotics includes yogurt, cultured drinks which are enriched with probiotics, and also certain fermented foods. So it's important that when you read the labels of the probiotic supplement, they must have the appropriate dosage as well as the strains of bacteria. So the important strains are things mentioned here. So Bifidobacterium animalis and lactis, as well as Lactobacillus reuteri and rhamnosus. Lacto-GG is the other important bacteria as well. So the dosage that is required for maintenance of a healthy digestive system and immunity is about 1 to 2 billion CFUs daily. CFUs actually refers to colony forming units, which is a way of counting the bacteria. And if the child is unwell with diarrhea or any other sickness, having constipation or taking probiotics, then the dosage will be 10 billion CFUs daily. And it's important to know that actually not all probiotics have the same actions and function. It really depends on the dose and the strain that is used. And based on what I've mentioned previously, those are the dosages and the strains that truly work based on the research studies. And usually probiotics is used as an adjunct alongside medical treatment. It should not replace the medical therapy if the child is unwell. And probiotics, as mentioned, have been shown to prevent certain conditions like antibiotic-related diarrhea and also eczema in high-risk patients, and they are generally safe. But we try to avoid it for patients with very compromised immune system. For example, patients who are on chemotherapy or on certain medications that suppresses the immune system for one reason or another. For prebiotics-wise, it is good to know that it is actually found naturally in breast milk. And one of them is called human milk oligosaccharide, or HMO, and an example of it is called 2FL. This is very, very important. And of course, probiotic supplements fortified with prebiotics. This is done very, very commonly because, as mentioned, the prebiotics are the food for the probiotics, and the presence of adequate amount of prebiotics actually helps the probiotics to grow within the gut itself. And other foods which contain prebiotics includes cultured drinks which are fortified, formula milk that contains prebiotics, that is very common nowadays, as well as certain other things as listed here like legumes, oats, bananas, etc. Yeah, so in summary, I think just to recap, these are the measures that can be taken to help to boost your child's immunity. So firstly, you consider exclusive breastfeeding for at least 4 months, but of course we need to strike a balance and avoid excessively stressing out our mothers. And then secondly, we need to make sure that our kids get their vaccinations, the correct vaccinations at the correct time and on time according to schedule. And you should strongly consider the optional vaccines, for example, influenza vaccine, sufficient sleep, healthy, balanced diet with lots of fruits and vegetables of various colors, exercise as a family with some sun exposure for vitamin D, stress management, avoiding second-hand smoke exposure, continuing going to school and childcare as per the guidelines currently, and also I think importantly is the measures taken to reduce exposure and spread of infections during this COVID pandemic, as we have highlighted earlier. And you can also strongly consider supplements containing things like vitamin C, zinc, Baker's yeast beta-glucan, and also very importantly food and supplements which are rich in probiotics and prebiotics from a very young age. Thank you very much.
Thank you so much, Dr. Dave Ong, for the very, very insightful sharing session. I'm sure these are very important tips for all parents-to-be and young parents. I myself learned a lot from this session. So thank you so much, Dr. Dave. Don't forget to check out Biostime Probiotics to support your child's immunity and digestive health.